So this is a good segue into the final session of our afternoon, which is on providing and hearing from the patient perspective. We've heard a little bit of that already, but I'm going to go ahead and ask the moderators, Kristi, Lara, and Jan Huynh, to come on down, and then also if Robert Alexander and Eugene Chin could come down toward the front here, that would be fine. So I'm going to first introduce the moderators, two just critically important members of our AYA program staff who do tremendous work and work directly with our patients. The first is Jan Huynh. Jan is a licensed clinical social worker for the AYA program here at the Norris Cancer Center. She provides individualized psychosocial care to AYA cancer patients who are both on and off treatment in the inpatient and outpatient settings. Jan supports AYAs by providing a safe, gentle, and nurturing environment for young people to communicate their deepest concerns. Jan is very knowledgeable about the developmental considerations when working with this population. With her clinical skills, she is able to elevate growth and optimize strength of patients to help develop skills to become proficient at using the systems we live in. Kristi Lara is a medical oncology physician assistant who specializes in sarcoma, melanoma, and refractory testicular cancers. She received her undergraduate education at UCLA and earned her joint Master of Science in Physician Assistant Studies and Master of Public Health at Touro University, California. She's worked in hematology oncology since graduating in 2011. Kristi began her career at USC in 2013, specializing in sarcoma, melanoma, and genitourinary cancers. She joined the USC faculty as a clinical instructor of medicine in 2018. Since Kristi began her career at USC, she has been passionately involved with the USC AYA program, recognizing the intricate needs of this unique patient population. And I'll also add that Kristi's been a great supporter of our Life Cancer Survivorship Clinic by referring appropriate patients to that. Kristi is certified by the National Commission on Certification of Physician Assistants and is a member of the American Academy of Physician Assistants and the California Academy of Physician Assistants. So Kristi and Jan, please come on up and introduce your speakers, and thank you for moderating this session.
Thank you, Dr. Freyer. Good afternoon, everyone. It is an honor to be moderating this section of the meeting with Jan. We will now hear from our own AYA survivors who will share their own unique and inspiring story.
Hi, everyone. Before we get our speakers up here, I just want to highlight a few things. This morning, Dr. Hellman said something simple yet profound. He stated, "We don't forget our patients." Troy also shared a photo of a young man who was able to reach a huge milestone in a young adult's life, just getting married. And I highlight this because it's a gentle reminder that our patients are at the center of everything we do, and it is important to hear their narratives and learn from their experiences, and that cancer is just one part of their life. As we proceed into this next portion, I would like to introduce our first patient perspective speaker, Robert Alexander. Robert was diagnosed with Rhabdomyosarcoma over 5 years ago. He was treated here at USC. He is here today with his father and his girlfriend. He currently lives in Brea and he's working full time. So please join me in welcoming Robert Alexander.
Good afternoon, everyone. My name's Robert Alexander. I live in Brea, California, and I work in Garden Grove at King Shock Technology as a production scheduler. In October of 2013, I was diagnosed and treated for testicular cancer. The urologist told me that testicular cancer had a pretty good success rate and that I should be okay. So I was put on a watchful waiting program. Not long after, I started having leg pains and back pains. I went to the emergency room several times seeking relief and was told it was just sciatic nerve pain and it would go away. By the end of December, my pains had increased and I was losing feeling in my legs and not able to walk. After getting an MRI and reviewing the images with my doctor, I found out that I had a tumor in the base of my spine. I was treated at St. Jude Medical Center and had an emergency surgery the same night. Dr. David Park, who studied here at USC, was my oncologist, and he thought that there was something strange about my case. After 3 days, he discovered that I did not have testicular cancer and diagnosed me with rhabdomyosarcoma. He told me that he could not treat me for this, so he made a call to USC Norris, and I was accepted as a patient. I began treatment at USC with Dr. Hu immediately. I'd like to take a moment and thank Dr. Hu and his staff for the wonderful work that they do. Thank you, Dr. Kristi, Lara, Lance, all the nurses, and the staff that helped me get better. Thank you, guys. My treatment consisted of chemotherapy and radiation. I did chemo for 8 months, from January to August, and radiation for 2 months after the chemo. My treatment was very difficult, but I feel that I had some advantage because I was an athlete. I played baseball for about 18 years, and I knew my physical capabilities. Growing up, I trained with my dad and my brother. My dad would tell us that the last couple repetitions of our workout would be the most difficult, but those last couple repetitions would have the most impact and make the biggest difference. I used this approach during my treatment. I remember my last cycle being the most difficult and wanting to give up, but I did not. I fought through it, knowing it was important to complete the treatment. Dr. Hu told me that in order for the treatment to be most effective and have the best outcome, I needed to complete the whole treatment. I feel that nutrition played a huge role in my recovery. Continuing to eat and taking good calories was very important. This was very hard to do many days, but I knew I had to keep eating. There was one day when I didn't want to eat. My dad had made something for me to eat, and I told him that I wasn't going to eat it. He said, "No, we're not doing that. You're going to eat." So to keep me eating and to help start my days, I made a protein drink in the morning. The protein I used and still use is an organic, grass-fed, non-GMO, pesticide, hormone, and chemical treatment-free, microfiltered whey protein powder. It contains full range and highest levels of natural occurring glutathione precursors. I also add glutamine to this drink. This was something small and easy I could make and consume quickly in the morning to help my stomach start working so I could continue to eat during the day. The first couple of days after treatment were the hardest and when it was most difficult to eat. You have to keep eating and building strength so you're ready for your next treatment. It's very much like training for a sport or working out. You work out, exhaust your body, and after, you eat good nutrients and rest and prepare your body for your next workout so you can continue to build strength. Being positive is very important. My parents raised me to be a very positive person. I knew I had to stay positive during my treatment in order to have the best outcome. During one of my treatments, when I was staying at USC, Dr. Hu came up to my room and he asked me how I was able to stay so positive. He told me that not all patients have such a positive outlook, and that the patients with a positive attitude seem to do better than those that were not positive. I told him that I'm usually a positive person, and in this situation, I didn't really have a choice. My only option was to be positive so that I can concentrate on a positive outcome. Being negative or feeling negative about my situation wasn't going to do anything or help anything. I set goals to help me stay positive. At a young age, my dad taught me the importance of goal setting. My overall goal was to get better and beat cancer. This seemed like a huge goal at the time, so I made small daily goals to help me achieve my main goal. There are 3 keys to goal setting. Goals have to be conceivable, believable, and achievable. Focus on the things that will help you achieve your goals. If there's an activity that does not help you reach your goal, then you should probably avoid that activity. These are things that my dad would say to me growing up. I was paralyzed for about 6 months during my treatment and had to learn how to walk again. I had a great in-home physical therapist, Mike Forsgren, who studied at the Mayo Clinic. Mike went above and beyond his requirements as a physical therapist. He really wanted to help me, because he could tell that I was serious about working hard and that I wanted to get better. He worked with me a couple days a week and made sure that I was learning to walk again correctly. He pushed me much harder than I was expecting. The first day I was able to stand up and walk on my own, he put a 20-pound weight vest on me. Sticking with the physical therapy is a must. Taking the time and taking it seriously ensured that I would learn to walk again correctly. I set goals to help me get back on my feet and get stronger every day. Each day, I was able to do more and more, one step at a time, one day at a time. If your goal seems too big or too far away, break down your goals into smaller, more easily achievable goals. This might help you to stay focused and on the right path. I made daily goals for myself, and it's great when you achieve your goal and you get that satisfaction of achievement. It kind of makes you want to keep going so you can reach your next goal. And if you keep at it, before you know it, you're going to be at the doorstep of your main goal. Sometimes you might have to readjust your goals. When I started treatment, I was told that I would be doing 7 to 9 cycles of chemo. When I went in for my 7th cycle, I thought I was almost done. Dr. Who told me I would now be doing 14 cycles. This made me pretty upset, but I refocused and I readjusted my goals. I worked to complete the 14 cycles. Another thing that helped me stay positive and focused was the doctors and the staff here at USC Norris. They never told me that they couldn't help me or gave me a timeline of life expectancy. Instead, they told me that cancer was treatable and beatable. As I continued my treatment at USC, I started noticing there were patients here that didn't really seem sick or look sick to me. I wondered what these people were doing here. Then I realized that these were patients that were being treated and beating cancer. When I accepted this and started believing, it helped me to stay focused on my goal. I wanted to and knew that I could be one of those people too. Having a support system was very important. I'm lucky enough to have a wonderful family and friends that helped me and supported me during my treatment. This help and support made a huge impact on my success. It's great to see that USC also has a support system like the AOA to help patients when they need it. When I look back at my experience, there are a few things that were most important. You need to stay positive, set goals, continue to eat, work hard to complete the treatment, and stay focused. Take advantage of physical therapy. Physical therapy works. Make the necessary changes to give yourself the best possible outcome. Set yourself up for success. There will be changes that you need to make. It might be diet changes, lifestyle changes, or both. Be happy and look at the big picture. Focus on the things that are really important, not so much on the little annoyances of daily life or things that don't matter. Have an awareness of a healthy mind and body connection. Take it one day at a time and thank God for every day that we get. Don't give up. Cancer is treatable and beatable. Fight on, USC.
Thank you, Robert, for sharing your story. Our next speaker is Eugene Chin. Eugene is 31 years old and lives in Orange County. She works as a flight attendant and loves to travel. She was diagnosed with synovial sarcoma of her right kidney at 26 years old. She is 4 years cancer-free as of April of 2019. Please welcome her.
Hi, everyone. Like Kristi said, I work as a flight attendant. I'm going to give you a quick safety briefing. There's 4 exit doors, 2 doors, and 2 doors here. Please do not leave while I am speaking. I've been doing that for about 3 years. I love my job. I live in Orange County. That's where I grew up and have lived most of my life. I was diagnosed back in October of 2014 with stage 3 synovial sarcoma in my right kidney. I had surgery to remove my whole kidney, then did about 4 months of chemotherapy. When people find out that I'm a cancer survivor, the most common question that they ask is, what were your symptoms or how did you find out? And to be honest, I did not have any apparent symptoms. I just felt a lump one day. And when I think back, I did have some symptoms. I did have some fatigue, but that kind of stuff is just part of life. Adults are tired, and when you work, you're fatigued. But I didn't have any apparent symptoms, and I didn't think much of it. But about a week went by, and the lump was still there, and I just had a weird feeling. So I decided to go to the doctor. And the day that I decided to go to the doctor was the day that changed the course of my life. So the doctor confirmed that there was a large tumor in my kidney, and it turned out that it had started growing into my inferior vena cava, the vein that takes blood up to your heart. And because they weren't sure if the tumor was solid or how solid it was, there was a sense of urgency to have surgery done as soon as possible. During this time, I was actually living in Sacramento. I had been there for about 4.5 years. I was working, and I really liked it up there. I had a great group of friends. I had a boyfriend. I had a whole life there, and I had no intention of moving. But when the doctor told me that they wanted me to do surgery as soon as possible, and they had referred me out to San Francisco, I said I did not want to have any kind of procedure done because I didn't have any family support. So within 2 weeks of that first doctor's appointment, I was back in Orange County with my mom, and I had surgery done at USC. So it was just very unexpected and happened very quickly. And following my surgery, they did a biopsy, and it was confirmed that it was cancerous, and the recommendation was to do chemotherapy after. So I had about 2 or 3 weeks to rest and heal up from the surgery, and I went back to the hospital to meet Dr. Hu to discuss our chemo plans. And during this time, I was having a lot of issues post-surgery. I had, pain from my incision, but I also had shortness of breath, and I had no appetite. I couldn't sleep. And then I was swelling all in my limbs and my stomach. And when I met Dr. Hu, he could tell right away something was wrong. So he listened to my heart, and he told me right then and there, hey, we're just going to have you admitted. And I'm like, what? I don't even have a phone charger. I don't have anything with me, But really, I didn't have anything. I just thought I was going to talk to him about chemo. And so he admits me. And it turned out I had a pericardial effusion. Basically, I had fluid that had built up in my heart sac, and that was causing all of that discomfort. So I had an emergency operation to drain the fluids, and I felt immediate relief. And what's so funny to me is thinking back, when I had my surgery, I was in the ICU for maybe 3 days or so, and they told me I had to walk because they didn't want me to have blood clots, and I was in so much pain, I couldn't do anything. And post the draining of the fluid, I actually felt immediate relief. I felt so much better, but they kept me in the ICU 5 or 6 days. I guess it's because it's heart related. And I just thought that was funny because I felt totally fine at that point. So that happened, and I had about a week or so to rest again, and I met with Dr. Hu again to discuss our chemo plans, and he explained to me that we would do 6 cycles. It would be 3 weeks apart. I would be inpatient 3 days each time, and he said it would be very aggressive and that I would lose my hair, and he also told me that there was a possibility I would become infertile. Oh. Sorry. Oh. So that was a lot of information for me to take in all at once, and just a big decision to make in such a short period of time. We had already pushed chemo back a couple weeks because of the complications I had post-surgery. So there was already, the sense of urgency to get it done as soon as possible. So he said, if you want to freeze your eggs, we'll give you 2 more weeks to go ahead and do that process. So I decided to do it. I froze my eggs, and then immediately after egg retrieval, I started chemotherapy. And the first round of chemo, I felt okay. I had some nausea and fatigue, but overall, I was still fairly healthy, and I felt okay. And I imagined, like, oh, if this is how it is, this is manageable. I can do this. So I go home, and within that first week, my hair just starts falling out, and it's coming, in chunks. And that moment was probably the most traumatizing experience up to that point. And so rather than trying to preserve my hair as long as possible, I just decided to shave it because I did not want to see my hair fall out every day. So I decided to shave my head, and then I saw myself, and I looked like a cancer patient. And that's when reality hit, that this was real. So I continued with my treatment. I did 5 more cycles, but every time I continued with treatment, I developed more side effects, and it got harder and harder. So it wasn't just a little bit of fatigue and nausea. I just was not able to eat at all. So I lost a lot of weight. And then I started having, I was bruising easily. I had changes in my skin and nail beds. I had heartburn and constipation. I had no period. I could see the physical changes inside and out. And that it was just breaking down my body. And honestly, it was hard. And towards the 4th or 5th cycle, I remember talking to my cousin, and I told her, I was recommended 6 cycles. If they told me I have to do like 3 or 4 more, I think I would say no. I don't know how much more I can endure. This is just so hard. But the hardest part wasn't necessarily the physical aspect of it, because up to that point, everything happened so quickly, right? I moved unexpectedly. I had surgery. I had fertility treatment. And again, it wasn't really my choices. It was just like things that were recommended to me, but it was things that had to happen. So I didn't really have time to process or think about what was going on. And when I started chemotherapy, I all of a sudden felt like time stopped because I had so much downtime. And because I was so weak, I was home a lot. And then I was also spending a lot of time by myself. And that's when I had my emotional and mental breakdowns. I had gone from being so independent and being on my own to becoming so helpless. Sorry, one second. So I was so helpless and dependent on everybody around me, especially my mom. And that was hard. But then, because I was so reliant on everybody around me, I had the guilt of just the stress that I was causing other people, especially my mom. And as a family, we had already experienced this. My dad passed away from cancer 2 years before, like a year and a half before I was diagnosed. So I already knew what my family had gone through, and I knew what it was like to be on the other side. It's hard for you to go through something difficult, but it's another when you are on the outside and you don't know how to help that person, or you don't even know what the outcome is. And I just felt so bad because of the stress that I knew that my family was experiencing. Because, I didn't know what my outcome was. My surgery was successful, and, I wanted to believe I would be completely cancer-free, but you never know. And, so I had the guilt of that. And then there was just all the thoughts that were going through my mind of my future and, what I thought was going to be my plan. Obviously, things change, and I just felt this social isolation where I had nobody who really understood what I was going through, nobody like in my peer group, no one that was close to me that had gone through what I was going through. And I just felt so isolated and so lonely. And, like I said, before coming down, I was living in Sacramento, and that was where my support group was. That's where, my boyfriend at the time and all my close friends were. And so, not being with them too, that was difficult. And, so I just had a whirlwind of emotions, and most of it was negative. And, but I knew I needed help, so I reached out to my social worker. I called her and I just told her, like, hey, I just feel so alone. Like, I don't know. Like, this isn't what I was expecting, but it just all hit me all at once. And so she directed me to some different resources. She gave me different organizations and different ways that I can connect with other cancer patients or survivors. And, it did help. I was able to talk with other people who could validate what I was feeling and to reassure me that things were going to be okay. And, and for me, my biggest motivation was I knew that I was very lucky despite what I was going through. I knew that I was in a good position. I did have my family support. I wasn't in the worst condition, because my tumor was central in an organ. I had a good, possibility of my future, I guess. And so I just counted down till the last day of my chemo, and that's what I look forward to every day. I knew that this was temporary, that what I told myself is that your current situation is not your final destination, and whatever you're going through is not going to be like this forever. And so I just believed that, and I counted till the last day of chemo. And when that day came, it was April 3rd, I was so happy. I, just felt like I had overcome the biggest obstacle of my life. But, it doesn't miraculously change right that moment, right? Because in my mind, I was counting down to that day, but then integrating back into normal life and society wasn't really what I envisioned. I think for a while, I just imagined I would just go back to the life that I had, but what is the life I had? I actually quit my job. I broke up with my boyfriend. I realized how important your family is, and it's like I didn't want to go back to Sacramento at that moment, and nor did I have anything to go back to. And then, so I didn't have a job. I wasn't able to do much. I really wanted to get my physical abilities back. I couldn't even walk up and down the stairs at my house, and I just really wanted to be able to be active again. So that was one of the things that I focused on the most. And within that first year, I did 3 5Ks. I didn't really run it. I walked most of it, but it was something that I pushed myself for. And the biggest thing that helped me was I found this organization called First Ascents, and they provide like an outdoor adventure for young adults. And I went on a week-long whitewater kayaking trip with 9 other cancer survivors. And that was what helped me the most because, one, I was able to see that I'm capable physically of more than I thought I could do, and 2, I was actually connected with other survivors in different stages. And every night after we kayaked, we had a little kind of like a little circle where we would discuss different topics. And I just really felt like that was the first time I had a real connection, and I could see that there was life after cancer. So fast forward, it's been 4 years, and I can't say that the process after cancer has been, that easy. I've still have my ups and downs, but overall, I just feel so grateful to be where I'm at. I know that not everyone has a second chance in life, and the way I choose to see my situation is, I got that second chance, and I didn't have any responsibilities or anything that was holding me back once I finished chemo, and it was almost like I had a blank slate in life. I could do whatever I wanted to do. I, could just pursue whatever I wanted, and that's why I decided to become a flight attendant. That was something that I had been interested in for a while. And even that, the first time I interviewed with Delta Airlines, and that was my dream airline. And when I interviewed with them, I did not disclose my cancer because I was so afraid of the judgment. Employers can't judge you about medical history, but they also don't have to tell you why they didn't hire you. And it was really just an insecurity of mine. I didn't know if they would think that I was too weak or not capable. And when they asked me about my employee gap, I just said I had health issues, which could be, a wide variety of things. But I did find an employer. Later on, I found a different airline, and I did disclose to them. And I think over time, I became comfortable discussing what I went through, and I found my own voice of saying what I needed to say. Sorry, I feel like I'm rambling at this point, but just to finish this off, this April, I am 4 years cancer-free, and April is a very special month for me because, it is my cancer anniversary, but it's also the month that my dad passed away. And even though my dad and my cancer is not related, we did a genetic testing, there's no relation, but I choose to see it as my dad kind of made the ultimate sacrifice, and he's not here with me today, but I have a chance to live, and and I have to live my best life, not just for him, but for him. Not just for me, but for him as well. Thank you.
Thank you so much to Robert and Eugene for sharing their journey with us. I know it's a lot, and it forces you to reflect, and a lot of big emotions come up. So thank you so much for being so vulnerable with the group today. We have a few minutes for some questions from the audience, and we'll have Robert and Eugene join us in the front. Questions? Yes.
As survivors, do you guys see, because it sounds like you guys, particularly you, have connected with a group of people that have also had cancer. Do you find that to be a benefit? I can see how it would be a benefit, but do you see pros and cons? Because obviously with this group of people, there's chance of relapse, and you guys are doing great, but do you have friends and people you've met on your journeys that aren't, and how do you balance that? And again, the Survivor Guild, in my opinion, comes up in this. Do you have any advice, any pros, any cons, anything that we can take away from that to help encourage our patients?
So for me, during the time when I was going through cancer and I didn't know anybody that was in the same position as I was, it did help a lot. But I'm going to be honest with you, at this point in my life, because cancer is still a fairly sensitive topic for me, I almost have kind of disassociated with some of those people, only because, so part of that group that I met, we were all in different stages in our cancer journey, and some people that I met, they were they had a reoccurrence and some of them passed away. And during that time when I didn't have anybody to relate to and my life was just so confusing, it did help a lot. But I'm kind of an avoidant personality and this subject is very hard for me. And at this point in my life, I realized that being connected was really hard for me. So, I think that it does help, but, might not necessarily help everybody.
Hi, I'm Matt. So I'm curious as to what type of interest, obviously it was very scary news, the cancer, like the C word. How much, though, did you get involved with the sarcoma work and your particular subtype? I'd love to hear from both of you. Did you take an interest? Did you learn about it? Did you scare yourself with, with those horrible, articles, etc., prior to, the last few years when we started having some good results?
So when I first heard the word rhabdomyosarcoma, I had no idea what it was. I was told that it was very rare and very rare to have an occurrence in an adult over the age of 18, that this type of cancer was normally found in younger children. I did, after hearing it and being diagnosed, look into it and read about it and kind of see what it is. And I don't think I still had an idea of like how serious it was. I mean, I knew I was sick, but I did take somewhat of an interest to kind of see what it was. But it's not something I focused on. I didn't want to focus on any of the negative aspects of what it was and what could possibly happen. I was more focused on my own journey to get past it and what did I need to do to get better. So, but I did have an awareness of it. I did learn more about it, yes.
I'm similar as well. When I first found out, when I was first given my diagnosis, synovial sarcoma, I had never heard of that. So I did do some research, and honestly, there was limited literature online, case studies. And when I started reading it, a lot of the prognosis weren't good. And it was very discouraging because I remember the first time I looked it up, it was like 2 o'clock in the morning. I'm on Google, like at home. And I just started crying, and I woke up like my mom because I was like, well, I'm gonna die, like that's what it says. Like most patients die that have this. But I feel the same way. I don't focus on those statistics because Dr. Who, and I didn't say this earlier, but when I finished treatment and I met Dr. Who, he told me what my survival rate would be. And he said, oh, so now you have a 50% chance of it coming back. And I almost fell out of my chair because I was like, 50% after everything I went through? Like, what was it before? And he's like, 90%. So if you go 90 to 50, yeah, that's much better. But I was like, oh, okay, well, let's just flip a coin. Is that what it is? We're going to flip a coin and I'm going to get it or not. But, but it's all based on perspective. And I also do not choose to believe those statistics because, I also kind of believe in self-fulfilling prophecies. If you believe that something's going to happen to you, if you believe that you are the 50% that's going to get cancer again, you might. But I don't want to. I just want to have a positive outlook and just know that I'm myself, an individual, and I don't want to be part of that statistic.
I think we have time for one more question.
So we actually have a question for you if no one else in the audience does. So what words of wisdom or advice would you give a young adult facing cancer or another life-threatening illness?
I would tell a young person that cancer is treatable and it's beatable. It's very scary to hear cancer, the word someone's telling you have cancer, and the first thing you might think of is that, oh my gosh, am I going to die? But when you, like I said, when you accept that and believe that it is treatable and beatable, then you can work your way through it. And especially a young person, being younger, having a better advantage to do the treatment and make it through it and stay healthy. I think that's a huge advantage. So.
I would just let them know that we know that it's confusing and you have a lot of questions and feelings, but all of those it's okay to have those feelings and questions. And I know that people have different types of support. Some people might not have family or friends as support systems, but there is support out there, and there are groups that do care. And even if you are a stranger, there are ways to get to become part of the community that can help you.
Thank you so much from the bottom of our hearts. Thank you.
So we're about at the end of the afternoon, and we are ending where we started, which is with patient stories. And I can't really think of a better way to have set the tone this morning, or to have closed really a tremendous day. I think the story of David Stroud this morning, and then the stories given by Robert and Eugene, really do remind us why we're all here, whether we're basic researchers, whether we're clinicians or program builders and other kinds of researchers. I want to just say that the two of you have reminded us why it's so important, and thank you very much for contributing that. Just one reminder for those of you who are claiming CME credit, don't forget to check the guidelines. Where is that information, Shu, for people who are claiming CME credit? Sorry? Okay, there'll be an email sent to you if you're registered, and so you should be able to go ahead and submit for your continuing medical education credit that way. I'd like to thank the speakers today. I'd like to thank my co-director and course co-director, James Hu, Shu Lee, our program director, who organized really this entire thing. Thank you very much. And I'd also like to acknowledge the other members of our program here at USC. You've met most of them today, but not all. Wendy Chang is our data analyst. And are you here, Wendy? No, yeah, you're here, so thank you very much. And the director of our resilience program. Can you go ahead and stand up as well, please? Thank you very much. Good. So I'll actually just really close by quoting two things that stuck out to me from Robert and Eugene's presentations. Maybe this is as good as anything to end our day on, and we can have this to think about over the weekend. Robert said some very eloquent words about having goals in our lives that are conceivable, believable, and achievable. I think why don't we all sort of pay attention to that ourselves in our own lives, but also for our program as we continue to work together to improve outcomes for patients in the AYA age group who are diagnosed with cancer and treated for that. I think if we think about it that way ourselves, I think we can continue to see further progress like we've seen over the last several years. And finally, Eugene, thank you for saying your current situation is not your final destination. That's very eloquent and something also well worth remembering. And again, it's very applicable to where we are with AYA Oncology as well. I think we'll hopefully find ourselves in a better place even just a couple of years from now when we have the next one of these David Strout Symposia. Thank you all for spending your Saturday with us, contributing with your questions and your presence, and look forward for the next announcement to come. Have a great rest of the weekend.